To host our proceedings this morning, please welcome Executive Editor of Wired Magazine and author of The Decision Tree, Thomas Goetz.
Good morning. Well, hello and welcome to day 2 of the Health Datapalooza, or as they call it in Washington, the Health Data Initiative 3/FBRIXKZ. Is that correct? That's the technical. But welcome. Yesterday was an outstanding day. I think you'll all agree. We went through a huge amount of stuff, so much that I've lost my voice a little bit. So you'll have to allow me to warm up my vocal cords. We had 12 app demos. We had 9 amazing breakout sessions where we saw how the power of connecting health data with our health needs and our health institutions and organizations. We heard from the amazing mission statement from the CTO of the USA, Todd Park. Let's give it up for Todd Park, shall we? Todd has what I think is the best job title in the world, CTO of the USA. Doesn't get better than that, does it? And we also had this small restaurant owner from a little town of Red Bank, New Jersey, named John Bon Jovi. So that was kind of fun. It's been an honor for me to be on the same program as John Bon Jovi and to be listed alongside him. But let me just be clear. I play the cello, all right? I am not a rock star. He wrote Wanted Dead or Alive. I play the cello. But I think one of the things about the event that we had yesterday and the kind of power of health data is this thing that's happening in Washington that, as somebody who comes from Silicon Valley and Wired, it's a very powerful thing. It's a very powerful thing to see Washington catch up, as we say. Actually, at Wired, we talk about, people always think Wired can see the future. Right? People think that Wired, somehow we have some innate sense of what's going to happen. And the truth is that they're right. Yeah, we can. And you guys are all doing great. The future is great for you. You, sir, outstanding. Great job. 2013 was really good. Bob, sorry, keep trying, keep persisting. But otherwise, the rest of you, you're really doing great in the future. And one of the things that I think was so auspicious when I was able to come to Health Datapalooza 2 last year was to really see how, personally, I was struck by how Washington was in the lead, how Todd and what he had started and the other people in the federal government who were working on this mission of unleashing all this data, all this amazing bounty of data and information that could be turned into powerful information that could compel organizational change to work on this mission of better health. That chain was really way out in front, and it was all about Washington last year. I mean, it was really for me, and I'm being totally honest, it was an epiphany for me about how whatever's going on in Silicon Valley, whatever's going on in Cambridge, and the kind of technology world, there's something happening here. There's something happening here in Washington, and it's actually a much harder problem. It's actually this problem it's called what I call latent data. I'm a wordsmith, so it's a fancy kind of elegant term. You can use it, latent data. But it's latent data is this data that exists in our system that is just not being used, right? It's data that is left fallow, and too often we neglect it. We don't recognize the power that it could have. And that's what Datapalooza is, right? That's what the Health Datapalooza is turning latent data into powerful, actionable data that can really be this catalyst for change. And it's what we saw yesterday with the folks from Lafayette, Louisiana, right? They're ahead of the people in Lafayette, California. They're doing these amazing projects. I had lunch sitting next to a programmer from CMS, and we were talking about HTML5 and how useful that is as a new base for web development, and we were talking about agile software development. This is a programmer at CMS, right? And we're talking about Eric Ries and lean startup methodology. This is cutting edge stuff. So it's very impressive, and it's really something that I think really we can all see the future. We are all seeing and participating in the future by being here. You're out in front of that future. So let's get started. Let's get started with day 2. We have today some more amazing demos. We have a keynote later this morning by the former Senate Majority Leader Bill Frist. And we're going to start today by having remarks from the Secretary of Health and Human Services, Kathleen Sebelius.